Hi, my name is Dr. Michael Veslak, and today we're going to go through a low back exam that I do on all our patients actually, but in our clinic we're used to seeing very complex chronic patients that have been to a lot of different places, and we do certain tests that most people just don't do. So we're going to kind of just give you a little glimpse of what we do here in our clinic to try to find what the root cause of these particular problems are. So the first thing I do is, we check basic range of motion like every office. We do reflexes, sensory, like you've had in every office you've been to. But then what we want to do is we like to go a little bit deeper. So I like to evaluate each muscle as an individual muscle, so that way when I say you have a weakness, we know that muscle's weak rather than just making blanket statements like your core is weak. So the first muscle we're going to test is the gluteus medius. So I just bring the leg out, I'm going to have you resist, hold it for me, good. And then we're going to do the next one, and then hold. And the next one we're going to check is the IT band, or the tension fascia lata. Rotate the leg out, bring it in. So I'm going to have you resist for me and hold. That's good. And now I'm going to do this side. Go ahead and hold. That's good. Now what we're going to do is we're going to check the psoas. This is the muscle that I've actually found that most chronic patients have issues with. So the psoas has a lot of different actions. It's a big, long muscle that crosses two joints, the lumbar spine as well as the hip. I believe it's the only muscle that crosses two joints, and it attaches throughout the entire lumbar spine, including the disc fibers. See it all the time, almost 100% in all my chronic pain patients. So this is how we muscle test it, and then go ahead, hold this up for me. Good, and she's actually really strong. And then hold this up for me, and that one's not quite as strong. So what we'll do, we'll give this patient basic exercise to strengthen up that psoas, and when we do that, the back actually starts to feel better. And then